Welcome to our laser webinar. We are in the thick of laser season.
For sure.
It's all happening. We're very excited.
Very excited.
And we want to show you guys how to get the best skin with laser. It's
Absolutely.
one of our main tools here at Synergy. We've got some amazing devices that we'll talk about during this webinar. And we can't wait to educate you guys on all things laser.
Absolutely.
So let's get started. Okay, so a few things we'll go over today that are very important when you are starting your laser journey is skin health. I think that's the most important thing and why it matters and how you can achieve that with laser. The effects of aging, which is happening to all of us, and we are happy that we are aging, but we want to show you how to do it gracefully and as healthily as possible.
Absolutely.
The role of advanced laser technology, which is drastically changing all the time.
All the time. Yeah,
It's
for sure.
pretty crazy, the advancements that we have had just in the few years that I've been doing this, and I know you've seen a lot,
A
so
lot. Yeah,
it's
for sure.
it's powerful tool. Some of our top laser treatments and how to stack your lasers, which is very important, and we will talk about that a little bit later in the webinar.
Lots of fun.
Yeah, lots of fun topics. Okay, a few reminders. We have some special offers today for you all joining our webinar. If you stick on until the end, we are going to have a giveaway for a laser gift card. So who doesn't want that? And in the Q&A box, if you will drop your question at the end, we would love to answer anything that you have. And that's in the chat box. So just drop your questions. And Vicki and I would love to answer anything that you have. Okay, so my name is Emily. I have been with Synergy for 12 years. I did at one time perform laser treatments, but have since turned it over to the real masters of laser, which will be with me today, Miss Vickie. Vickie has been with us for 3 years. Vickie, tell us a little bit about how you got started in aesthetics and what you love most about it.
I got started about 15, 16 years ago in aesthetics. I actually went and got certified in lasers. I just thought it was really fun to be able to learn the background or the didactics behind it, how it works, why it works. So for me, it was just really interesting, and I really enjoy just helping people. So being able to do skin and be able to perform different skin treatments, and understanding how products at home are really beneficial, and then adding in the medical side of it with the lasers just was a lot of fun.
Yeah, yeah. It's truly a synergistic process when you are looking at a skincare journey as a
For
whole.
sure. Absolutely.
Okay, so Synergy, if you're new to Synergy, we have been in business for 20 years. We are led by our wonderful board certified plastic surgeon and clinical director. We have the gold standard really when it comes to laser technology. We will talk about all of the devices that we have, but we really do pride ourselves in having the best of the best when it comes to
Absolutely. Yeah.
skin technology. I think the most important thing about Synergy is all of the training that we do. Our providers are so just masters
Yeah.
at their craft, and the training is just ever going, and it's just truly makes a difference when you are looking at a practice to go to when you are wanting to get into aesthetics.
For me personally, I know I've worked at other locations, and the training was just kind of like a quick through
Mhm.
kind of training. And I was really impressed when I came on to Synergy. I had already been doing lasers for a long time, but they really kind of got into the nit and gritty and understanding not only why you're treating the skin, but the different devices, and not just how to push buttons and
Mhm.
be able to use it, but actually use it to its full potential,
Right.
which was pretty amazing. I felt like I learned a lot when I went through the training, so it was fun for me.
Yeah. Yeah, it's one thing to have the tools, but to really understand them and treat people's concerns and multiple concerns, it makes all the difference
Oh, for
in the
sure. Yeah.
world. And also, we are the #1 provider of Botox in North Carolina if you want to get into injectables.
Which work great for both, like doing
Exactly.
lasers and
Yeah.
Botox and fillers and all those
It
good
really
things, right?
all comes back to a
Yeah,
synergistic approach.
yeah,
So,
for sure.
thank you with being for us. Okay, so today we are going to talk about laser, obviously. Let's go over some of the technology that we have. So we have a few different devices
Yeah.
here. I would say that Cyton is probably the most popular device. I
For sure.
think people really know that name in the
It's
industry.
most advanced, I feel like, when it comes to the technology. I
Yeah.
feel like there's a lot of other devices out there that kind of do whatever it might be, if it's fractional laser
Mhm.
or BBL or IPL or anything like that. I think Sciton has been able to really hone in to make it the most comfortable and the most
Yeah.
benefit from the treatment.
Yeah.
So for me, I've just really enjoyed working with it.
Yeah. We also have Sofwave, which is an ultrasound technology
Yeah.
device. We
Yeah.
love Sofwave,
Yeah.
and we offer RF microneedling. So let's talk a little bit about BBL, which
Okay.
is on our Cyton platform.
Yeah.
Okay, so I'm sure a lot of people have heard IPL. At this point, a lot of people have heard of BBL, but can you kind of position the two of those and explain what BBL actually does?
Yeah. So IPL stands for intense pulse light. BBL is broadband light.
Mm.
So when it comes to like both of those technologies, the technology is to scan the energy across the top layers of the skin, and allow it to kind of absorb into what you're trying to treat. So if it's pigment, and it doesn't matter if it's sun damage or age spots, or if you're trying to go after broken capillaries or things like that.
Mhm.
That's the whole point of
Yeah.
what that particular laser does. The beauty of BBL versus IPL, I kind of say IPL was the beginning, and then it kind of advanced, and they were able to tweak it enough so it's a lot more
Yeah.
tolerable, a lot more
Yeah.
comfortable doing a BBL. The other additional nice thing about BBL is we're able to kind of really hone in with different filters to kind of go
Mhm.
after different levels and different depths, to go after different things that are concerning when it comes to the tone of the skin. And then it also has a nice another advancement to
Mhm.
it where it actually will stimulate collagen elastin.
Mhm.
And they were able to kind of filter out some of the wavelengths that made IPL so uncomfortable.
Mm.
I would do a lot of clients with IPL and they would want to like almost flinch because it
Yeah.
was bright and uncomfortable.
Yeah.
And I really feel like BBL isn't.
Yeah.
There isn't a ton of downtime. You normally will have like a little bit of black peppering or
Mm.
coffee ground kind of look afterwards. Um, but it just overall just really makes the skin nice
Mhm.
and clear and bright.
Yeah. I've seen clients that have done BBL regularly over the years, and
Hmm.
it's really incredible, like the quality of their
Hmm.
skin and just how they've been able to kind of freeze the health in that
Yeah.
state of
Hmm.
goodness.
Yeah.
It's truly amazing. I also, I know you've had BBL, I've
Yeah.
had BBL. It
Yep.
is quite comfortable.
Yeah.
There's a cooling
Like
panel
it has,
on it,
mhm.
and it's just it's really very tolerable. So we are.
And I will say too, the other benefit, like with IPL, the way IPL works, you really are just kind of going over the skin that one time, and you're
Mhm.
hoping and praying that you're gonna get all of
Yeah.
the spots and all of the discoloration in that one little pass.
Hmm.
And with BBL, they've been able to kind of hone in and go, well, we can use this tip here and this tip
Hmm.
here, and we if we don't get enough energy and we're not getting a good clinical endpoint, I
Hmm.
can kind of go back in
Yeah.
with a different filter and a different tip and be able to get enough energy in there to get the results. So the even after one treatment, you see such a good improvement in the
Hmm.
skin,
Hmm.
because we can specialize and focus in.
Yeah, very customizable.
Yeah.
Also with the, brown is one thing, but reds are very difficult to
Hmm.
treat. And there are so many people that struggle with like underlying redness
Hmm.
or capillary damage.
Hmm. For sure.
Can you talk a little bit about that with BBL?
Yeah. So, again, when it comes to BBL, because of the fact that we've got different filters, and different tips, we can actually use a really nice small tip, and get right around those nose, veins that, I mean, we call them
Yeah,
telangiectasias,
yeah,
but everybody seems to get them.
yeah,
And they drive everybody
they
crazy.
do.
And so you can hit them, see them disappear,
Yeah,
which is a lot of
yeah.
fun. And then you might have, I don't know, little cherry angiomas or little veins in the cheeks. Or
Mhm.
another one that it's great for is people that have rosacea,
Yes.
that will help control the rosacea so that it's not getting out of control.
Mhm.
And you can do a couple of treatments, get it under control, and then they can kind of maintain it.
Mhm.
So it just really helps, make the skin look beautiful.
Yeah. You touched a little bit on the treatment itself and the downtime, but kind of walk us through what it looks like to start to finish, kind of
Yeah.
come in and get a BBL and what the downtime is like.
Yeah. So doing BBL, obviously you want to be the lightest that you can possibly be because it's looking for pigment. And so you don't want to have recent sun exposure.
Mhm.
You don't want any sunless tanner on the skin, because it's looking for pigment.
Yeah.
So that's really the biggest thing. Because we're using a laser, you obviously don't want to be on a lot of different antibiotics that can kind of
Mhm.
make you
Yeah.
photosensitive. So that's something that I always like to talk to my
Mhm.
clients prior. But it's really a pretty quick, easy
Yeah.
treatment. We apply a gel to kind of help control some of the discomfort.
Mhm.
And like you talked about earlier, where it being, the tip has like a little coolant in
Cooling.
it,
Mhm.
to help control any kind of discomfort. And then afterwards, a lot of times people might have maybe a little bit of splotchy, pink, especially if there's like bigger veins, you might have a little bit
Mhm.
in those areas. The pigment itself, it actually will continue to darken up for the first 12 hours. Um,
Which is really cool to see.
Yes, it's so much fun to see. And I'm always telling my clients, don't pick at it,
Yeah.
don't
Yeah.
mess with it.
Leave it alone.
Just leave it alone, watch it get darker.
Yeah.
And then as you cleanse over the next couple days, it'll start to lighten up.
Mhm.
But most people within 30 minutes, most of the pink will
Mhm.
go
Yeah.
away. If you have a tendency to be a little red, it might last a little longer than that.
Mhm.
But most people are able to kind of go about their day
Yeah.
with no issues. You can most of the time use like a tinted, SPF, and blend out the skin and not have to worry about
Yeah.
having any just,
Yeah.
crazy
Any
looking skin.
visible, yeah,
Yeah.
downtime.
Mm-hmm.
Okay, so before and afters, these are always very fun. So talk about this patient a little bit. I
Okay.
see a little bit of hyperpigmentation,
Mm-hmm.
but kind of talk to us on why she would be a great candidate for
Yeah.
BBL.
So it's not just about those people that you look at and you're like, oh, wow, they have a lot of sun damage, or
Mhm.
oh, they have a lot of broken capillaries. BBL is great for that. But overall, if you look at her skin, you can kind of see how it just has a lot more glow to it. It looks
Mhm.
a lot brighter.
Yeah.
And that's kind of the benefit of the addition that BBL does to the skin, which is stimulating that collagen and elastin by causing a little bit of thermal damage. It also kills bacteria, so that's
Mhm.
the other nice thing. If somebody has, acne, it's great for treating acne. We can
Mhm.
kind of control some of the redness
Yeah.
that way, kill the bacteria, and prevent future breakouts. But yeah, for this client, she doesn't, I mean, she's got pretty skin. She just wanted a little bit of extra improvement. So just help and brighten the skin back up, and stimulate that collagen elastin just to keep the skin looking pretty.
Yeah, it's a great result.
Mm-hmm. So this person, I always say you can really see sun damage, when it comes to the sides of the
Mhm.
face. And a lot of times that's just like riding in the
Yeah.
car and things like that. So this person had a little bit more distinctive sun damage. And so I love these for BBL
Yeah.
because you can actually see it darkening up as you're treating, which is a lot of
Yeah.
fun. And because most people are visual people,
Mhm.
like you see it darkening up and then you see it lightening
Mhm.
after that. It's just fun.
Yeah. She also looks like she has a little redness on her
Mm-hmm.
cheeks that has improved quite a bit.
Mm-hmm. Yep, and around the nose too.
Mhm.
Yep. So this one is one that you would say like that person that probably when she goes to the gym or she takes a shower, she
Yeah.
probably gets a little bit more pink or
Yeah.
red in that area, which can be frustrating for a lot of people.
Sure.
So the BBL basically restricts those blood vessels and breaks them down, and so you don't have that flushing or redness.
Yeah.
And then she probably, if we looked a little bit closer, might have some bigger veins that we can kind of get rid of and
Hmm. Yeah, that's a
get those
great
under control.
result.
Yeah.
Redness can be such a pain
Frustrating.
to deal
Yeah,
with.
it's very
Yes.
frustrating. And I usually tell my like rosacea clients, you're probably going to have to do a couple of
Sure.
treatments to kind of get it under control. And it's really about like, where did you start
Yeah.
from? Is your rosacea way out of control or is it just starting?
Hmm.
And a lot of times you can do like a couple of treatments and then really it's about maintenance
Sure.
after that.
Yeah.
And then you don't ever have to get to that point where you feel like you're constantly
Right.
flushing,
Right. Yeah.
when you're out and about in the cold or whatever.
Yeah. Okay, so MOXI. This is a fun one
Yeah.
because almost everybody is a
Hmm.
candidate for
Yeah.
MOXI.
This is a good starter one too.
Yeah, it's a great starter one. Talk a
Mhm.
little bit about what MOXI does.
So I love MOXI because you can do it on all skin tone
Hmm.
types. So it doesn't matter if you're super fair or if you're a little bit darker. You can do it on all skin
Hmm.
tones. A lot of people will do it throughout the year too.
Yeah.
You obviously don't want to have any recent sun exposure,
Yeah.
any sunburn or anything
Yeah.
like that. But this one is great for introductory because most of my clients, when I treat them, we use a really good numbing
Hmm.
treatment. And
Yep.
so
Yep.
by the time you numb, I'll say like 1 to 10, what is the worst
Hmm. Hmm.
pain? And they're like,
It's
2.
not
So
really, yeah.
yeah, there's
Yeah.
not a lot of discomfort in it, but it's great for evening out the texture and
Yes.
tone of the skin.
Yes.
So if you feel like, my texture just feels a little rough, or I just feel like my skin feels a little dull, it's great for helping with that.
Hmm.
So just overall, the texture and feel of the skin is
Hmm.
great after a Moxie. Um, and it's a fractionated laser, and there's tons of them out there. I feel like every laser brand has some kind of
Hmm.
fractional laser. Moxie is great because I feel like you don't have as much downtime,
Right.
and the discomfort is a lot less, but the
Yes.
results are even
They're
greater.
amazing.
Um, I do even a lot of my melasma clients with
Yeah.
it. So melasma is another little sticky situation
Mhm.
where it sometimes can be a little hard to get under control.
Yes.
So normally we'll do I had always done chemical peels to try
Hmm.
to keep it under control. Moxie's the first one that I have clients that
Hmm.
were like, it's the only thing I'm going to
Yeah.
do treating my melasma. It really helps improve the skin.
Yeah.
So,
It's extremely effective. And melasma, for anyone that doesn't know, is a hormonal hyperpigmentation
mhm,
disorder that usually occurs during pregnancy,
right.
but not always.
Yeah.
And it typically looks like a mask over the lip, or it kind of clusters
A
together.
lot of times people get it kind of like on the forehead. You'll see it in the corners of the forehead, in the cheek area, right along the lip. People will say, I feel like I've got a shadow or, a mustache in that area just because it's a little bit darker. And it's great for just kind of clearing all of
Yeah.
that up.
Yeah.
And there's not a ton of downtime. I say with this one more than with BBL. You might be, I always say red like a tomato for the
Yeah.
first 24
Yeah.
hours, mild swelling.
Yeah.
And then after that, the skin kind of feels like sandpaper for 7 to 10 days.
Yeah.
But most of my clients are like, yeah, I was red for the first couple of days. And then after that, no one would have known I had
Yeah.
anything happen.
And you're able to put like tinted moisturizer on,
For
and
sure.
really, I mean, people don't notice. You'll feel it, but I don't feel like people visually notice
Oh,
it.
for sure not. Yeah.
So
Yeah.
you can live your life and, not
You
hide
can
it
be
when
on
you're home.
screen and still
Yes,
be working
exactly.
and not have any issues.
So she looks like she does
Melasma.
melasma.
Yeah.
Yeah.
So this is like a perfect example of melasma. People will ask me like, what's the difference between melasma and sun damage? Sun damage is like speckling
Hmm.
of dark, where melasma is patchy.
Yeah.
So you'll have these patches like on the forehead or the cheek or the upper lip kind of area. And so it helps just really even that out. And then obviously, you're going to use different products to kind of help suppress those melanocytes that
Hmm.
are overactive,
Hmm.
which is basically the melanin in your skin that gets a little overzealous and causes those dark spots.
Mhm.
So, you kind of hit it from both angles.
Yeah. Yeah. She had a great result.
Hmm.
That's pretty amazing.
This is another one where if you looked at her on a normal day, you'd be like, oh, she's got pretty
Great
skin.
skin. Yeah.
Yeah, she's got pretty skin. But you can really see a huge difference from pretty skin to beautiful skin.
Mhm.
So she's got, just a little bit of sun damage, discoloration, probably a little bit of acne scars. And
Mhm.
whenever we have acne, it will cause the PIH, which you were talking
Mhm.
about earlier, which is just a little bit of darkening
Mhm.
of the skin. It also breaks capillaries, so you have redness. And so it just kind of evens out that tone, and just helps give it a nice little glow. And if our texture is pretty and nice and smooth, it reflects the light. And so you
Mhm.
get a nice little glow to the skin.
Yeah. Just a nice polish is what
Mm-hmm.
it looks like she
For sure.
she received. This is a great one.
Mm-hmm. So this is somebody that has that, sun damage that is kind of speckled.
Mhm.
Probably maybe did not use sunscreen when they were younger. I know I was at
Yeah.
fault for doing that, and I
Definitely
didn't
didn't.
use, yeah.
Yeah.
And then all of a sudden you're like, what happened?
Yeah. Yeah.
So you just have that speckled sun damage throughout, and this is a way to just kind of slough all of that sun
Mhm.
damage that's on the surface, and just help with the texture of the skin.
Beautiful result.
Mm-hmm.
Very beautiful.
Yep.
We love the body. Don't
Yes.
forget about the body.
Yeah.
Chest is a big one, especially in the
For sure.
South. I think,
Yeah.
we get so much sun,
Mm-hmm.
and you start to notice the effects of what it's done to your texture
Yeah. For sure.
in addition to the pigment,
Yeah.
which I think MOXI really does a great job with
Yeah,
texture.
we do a lot of like BBL and MOXI face, neck, and chest. I
Mhm.
feel like I mean, people used to only focus on face there for a
Mhm.
while, and I think people are really starting to realize like you can see the age, you can see the
Mhm.
discoloration, not just face, but on my neck and my chest.
Yeah.
And MOXI is beautiful for helping out with the chest and just kind of blending it all out. So yeah, we get really good results from that area too.
Yeah. That's very beautiful.
Mm-hmm.
Okay, so RF microneedling. We're
Yep.
getting a little bit more mechanical with our devices
Yeah.
now. So we have regular microneedling, but
Mhm.
talk a little bit about why RF is different from
Yeah.
standard microneedling.
So you have regular medical microneedling, which is basically, I always say, is like aerating the skin.
Hmm.
It's putting tiny little holes into the skin to tell the body, hey, I need to come and help.
Yeah.
I need to stimulate that collagen and
Yeah.
elastin. So, how RF microneedling versus medical microneedling is different. When those needles go in to help aerate the skin and stimulate that collagen and elastin, it causes a little bit of thermal damage or heat damage to the
Hmm.
area. And it's very controlled thermal heat damage. And it just is kind of like medical microneedling on a boost.
Yeah.
So you get much quicker, much better results with RF microneedling than you
Mhm.
would get with regular microneedling.
Yes.
This is kind of my go-to for somebody who has acne scars.
Yeah.
It's beautiful acne scars. Um, Also, people that are wanting a nice little lift or
Hmm.
tightening to the skin,
Hmm.
which is why it works really well for people that have acne scars, because people that have acne scars not only have texture issues, but they might have ice pick scarring or scarring, which is just like those little divots in the skin.
Hmm.
So we really need to kind of get in there and help plump that up and
Hmm.
tighten it up.
Hmm.
So having the RF microneedling works really well for that.
Yeah.
And then somebody that is like, I don't really want a facelift. I don't want to have
Hmm.
to do anything too crazy, but I just want to tighten the area
Hmm.
along my jawline.
Hmm.
That this is great for it.
Yeah. So downtime with microneedling, would you say it's similar to probably something like
Yeah.
MOXI? It's kind of the same.
Yeah.
You'll be a little crusty for a
Yeah.
couple of days, maybe a little pinkness, but
Yeah.
you can still put makeup on and live your life.
Yeah, and you will normally have a little bit of swelling too, and we
Mhm.
actually want the
We want it.
swelling. So a lot of people will ask me, they're like, "Oh, can I take, ibuprofen?" I'm like, "Well, if you want to, if it's
Yeah.
really uncomfortable, you can, but try not to,
Hmm.
because the swelling is what's stimulating that collagen and
Hmm.
elastin. Now, it's not crazy swelling.
Hmm.
It's I notice it when I'm doing the treatment. I
Yeah.
can see it. You know it because of the fact it's your
It's your
face,
face.
but anybody going about looking at you would not necessarily know
Necessarily.
it.
Yeah.
And again, it all depends on the person. If you're the type of person that is a sweller, you're gonna maybe have a little bit more than somebody else. But normally it's most 48 hours.
Mm-hmm.
And then same thing, like you said, with the MOXI, it's that crusting,
Mm-hmm.
and that usually lasts for 7 to 10 days.
Yep.
So yeah, very similar to MOXI
I think it's
downtime.
important to note too with RF microneedling and with pretty much all of these devices, if you are really trying to correct something,
Hmm.
how many treatments are you recommending for people?
So anytime you do laser, I always say you need to do a series of them.
Mhm.
Does it mean that you're not going to get benefit and correction by just doing one? No, you're going to get benefit and correction, but it's almost like a building block.
Mhm.
So you start off with seeing a decent improvement after that first one,
Mhm.
and then you're continuing to build off of that, and
Mhm.
you get further along and
Yeah,
closer to your goal
right.
by doing a series. So
Yeah.
most of the time, I say three, maybe four, depending on what we're doing.
Yeah.
A lot of times, too, I like to do different devices, maybe not all like do RF microneedling and do three right in a row. I
Mhm.
might change it up depending on like what's going on with the skin, which is fun
Yeah.
too. So
Yeah.
it all depends.
Yeah. So there are some add-ons. Let's talk a little bit about salmon D. That's very hot right now.
Yeah.
We are absolutely loving it.
Mhm.
Why are we putting salmon DNA on the skin?
So I always giggle almost a little bit every time I mention this to a client because I know they're like, you want to put what
Yeah.
on me? Um, but salmon DNA is just amazing in the sense where it really gets our body communicating much better.
Mhm.
And so for a long time, a lot of people were asking about doing like the vampire facials
Mhm.
and doing, what's the difference.
Mhm.
Now I'm taking the blood and I'm spinning your blood, and I'm hoping to get some good stuff out of there to really help promote
Mhm.
that collagen and elastin. We've come to kind of find that depending on how healthy, your
Right.
age, all of that,
Mhm.
the good stuff might not be in there as somebody who's older or somebody who's on certain medications.
Mhm.
And so by being able to have something that is stable, no matter what age, how healthy you
Yeah.
are, whatever, you're getting good stimulation of collagen and elastin.
Yeah.
You're getting a lot of hydration and hyaluronic acid into the skin, which helps plump up our skin and make it healthy. Um, so it just really helps improve the skin,
Mhm. Yeah.
and kind of turn back time a little
Yeah.
bit.
Yeah.
And the nice thing is we've got two different ones. We've got the booster,
Mhm.
which is really nice when it comes to somebody who doesn't want to get into lasers.
Mhm.
And then we also have the more advanced
Yeah.
one
The
that has
healing.
all the really
Mhm.
good stuff in
Yeah.
it
Yeah.
to help heal it. So the
Yeah.
downtime is so much
Yep.
less, the redness, the swelling. Once people try this when they're doing their lasers, they don't want to not do it,
Mhm.
because they just see the improvement with it. And then the downtime and the healing
Yeah.
is so much faster.
Yeah, the emphasis on healing these days, I'm glad that it has kind of evolved into this because
Yeah.
it's so important what you're doing after the main treatment.
Right.
You need that icing on the
Yeah.
cake, and that's where, salmon DNA or other serums really come in,
Yeah.
kind of help fill that gap.
Yeah, because I feel like, years ago, whenever I would do lasers, it was almost like you'd cross your fingers and
Mm,
be like, please make sure that this person takes good care of
yeah,
their skin
yeah.
and that they really listen.
Mhm.
And by having things like this that we can
Yes.
apply to the skin, um, we can give them good products to use at home, but we know that we're sealing it in a little
Yeah,
bit better when we have products like this to be able to apply
yeah.
afterwards.
This is the insurance.
Yes, the
It's
insurance,
the
we're going to have good
Yeah,
results.
yeah.
Yep.
Okay, so RF before and afters.
This is the tightening.
This is definitely the tightening.
Hmm.
And her fine lines. I mean,
Hmm.
definitely for deeper lines, RF is going to get in there and really plump things out. I mean,
Hmm.
the lines on her neck are, I mean, pretty much
Gone.
gone.
Yeah. Yep.
That looks incredible.
So these are those lines that are super hard
Mhm.
to and drive people crazy. They're small lines and people are like, "Oh, these drive me
Yeah.
crazy." And I've thought about doing filler. And the nice thing about, like we talked about earlier, when it comes to RF microneedling, we can get the body working and plumping things up, and then You might still do filler after
Mhm.
that, but you don't have to use as much filler and
Yep.
you can kind of just top it off a little bit.
Yeah.
And it just makes a nice, beautiful treatment plan.
Yeah, definitely.
Yeah.
Here's the
Acne scars.
acne scarring.
Yeah.
Yep, the acne scarring, which is
Yep.
so hard to treat,
Yeah.
and so devastating for so many people.
Hmm.
So this has really been an amazing tool
Hmm.
for people struggling with scarring.
Especially too, like there are a lot more out there for acne scars on people that have a lighter skin tone.
Mhm.
Darker skin tone, it's much harder
Yeah.
to treat. And that's what's really nice about RF microneedling because we're going so deep. So we're kind of surpassing those melanocytes or the pigment in that area.
Mhm.
So we can treat it on all skin tones
Yeah.
and types, and get some really good results from
Yeah.
it.
Yeah. Okay, halo. So now we're getting into a little bit more aggressive
Yeah.
treatments. Talk about halo.
Yeah. So Halo is also a fractional laser, but it's ablative and non-ablative. So
Mhm.
basically what that means is non-ablative is we're fractionating the skin, we're getting deep into the skin, but we're not taking a layer of skin off on the top.
Mhm.
When you get into ablative, that means that we're taking a small thin layer of skin on the very top. The benefit of having that dual
Mhm.
is because most people don't have just one issue,
Mhm.
right?
Yeah.
So on the top layer, they might have pore size, that their
Mhm.
pores are really stretched out over time that might drive them
Mhm.
crazy. They might have those fine lines that kind of are just on that very surface. So having that ablation to kind of take that off,
Mhm.
some sun damage is on the very
Mhm.
surface. But then also being able to go deeper into the skin, so if we have like acne scars
Yeah.
or we have deeper wrinkles, which are scars,
Yeah.
we can stimulate that collagen and kind of plump that up. So it is great for kind of hitting it on both
Yeah.
angles. So it's great for acne scars, great for anti-aging, great for fine lines and wrinkles, pore, texture. It's just a nice anti-aging laser.
Yes. So let's talk about downtime because it's a little more
Yeah.
extensive. I wouldn't say it's bad, but I've
Yeah.
noticed with my Halo, the swelling
Hmm.
is a little bit different from any of the other devices that I've
Yeah.
experienced.
Yeah.
So it's usually, what would you say, 5 to 7 days?
So I usually will ask, and this is kind of a strange question, but I usually will ask people like, when you get a bug bite, do you
Mm,
swell?
mm-hmm.
If you're a sweller, when you get a bug bite, you're going to be a sweller when you get
Yes.
laser.
Yes.
So I usually will tell people, understand that if that is an issue,
Mm-hmm.
there's a couple of things that you can kind of combat it.
Mm-hmm.
One is we have a product CMT that is great.
Mm-hmm.
Obviously, doing the salmon
Yep.
is also another one
That
that is
helps a lot.
great. It
Mm-hmm.
helps a lot. Also, just kind of being a little propped up when you sleep that first night, because a lot of times when you have swelling, it's around the eyes.
Mm-hmm.
And people will ask, they're like, well, you didn't laser,
Mm-hmm.
inside my orbital rim.
Mm-hmm.
Why am I swollen there?
Yeah.
And it's just when we sleep at night, the water is causing that little bit of
Mm-hmm.
swelling in that area. Which reminds me that when it comes to lasers, I always tell my clients, drink tons and tons of water.
Stay hydrated,
Stay
people.
hydrated
Mhm.
because you will actually get better results when you're hydrated versus
Yes.
when you're dehydrated.
Yeah. Yeah.
So, especially on a laser like this that's looking for water,
Mhm.
being nice and hydrated
Mhm.
is you're going to have better results from the
Really
treatment.
helps.
Mm-hmm.
Because this is a more aggressive laser,
Mm-hmm.
you typically need less treatments than
Mm-hmm.
some of the other ones.
Mm-hmm.
If someone comes in with all of the issues that you just listed out, what
Mm-hmm.
are you recommending for them?
So it depends, like everything, it depends on the person. I normally will say 1 to 2 treatments,
Mhm.
depending on what is your expectations.
Yeah.
Some people will say, oh, I just want to see some improvement. I don't have to be like a 180 type
Mhm.
of improvement.
Mhm.
So I'll say, let's do one and see what
You're
happens.
right.
Let's have you come back in. Let's do another Visia on you, and take a look. And then if we feel like we need to do another halo, we can do another halo, or we might end up just doing a BBL or a MOXI or a chemical peel. There's lots of other options.
Mhm.
So I don't normally try to overpromise and tell somebody you're
Right.
going to have this amount of
Yeah.
treatments. But Halo is definitely one of those that is great for doing at least one. maybe 2, depending on where you're starting,
Mhm,
especially if it's somebody who's a little bit older and has deeper scarring
mhm,
or acne scarring, they're
mhm,
probably gonna need to.
mhm.
And then it's once a year
Yeah,
coming in and getting a treatment done.
yeah. Okay, so before and afters.
Yeah.
And
So
she has great skin to
yeah,
start with.
yeah, she's got great skin. You can definitely see it's much brighter
Mhm,
after the treatment. Those fine lines and wrinkles are softening. Just the overall health and brightness of the skin
mhm.
definitely improved with her treatment.
It's really good.
Hmm. And a lot of people will ask me, do you want to do, how quickly do you want an improvement? So when it comes to the difference between like maybe a Moxie or a
Mm,
Halo,
mm,
sometimes I'm like, if you're okay with a little bit more downtime, let's just knock it out with a
yeah,
Halo. And other people are like, I don't
yeah,
know if I want that
yeah,
downtime. So maybe let's do a series of
right.
Moxies, and then add in something along
Yeah.
the way.
Very customizable.
Hmm.
So
So
she looks incredible.
yeah. So this is one that you're like, hey, this is the anti-aging laser. This is really helping with those fine lines and wrinkles. But the difference between fine lines and wrinkles, fine lines are just kind of on that surface,
Mm,
where wrinkles are more like scars, are really deep and stagnant. So even when you're not making a facial expression, they're still kind of stuck there.
mhm,
So doing a halo really plumps up that collagen. So the collagen plumps up the skin, the elastin gives it that snap back. So this has really kind of helped her look a lot more youthful.
mhm.
I mean, she looks like 10 years younger.
Without a facelift.
Yes. So, I mean, can't beat that. Same with her.
Mhm,
So you can definitely tell, like, not only just on the face, but, along the neck area. It just helps kind of tighten and lift that skin, help with the texture and feel. And I don't think people realize, you actually, I feel like, look older when you have discoloration on your skin.
mhm,
When you clear that discoloration, you get rid of the brown spots and those red spots, the
mhm.
skin just looks healthier
Right.
and younger.
Yeah.
So just being able to clear that with having the halo, being able to take off that damage that's on the surface and going deep to kind of plump and tighten things up,
Mhm.
really just kind of makes you look younger.
Yeah, yeah. Okay, Sofwave.
Yeah, I love Sofwave.
Sofwave is amazing.
Hmm.
This is a little bit different from a laser.
Yeah.
Tell us exactly what Sofwave is.
Yeah. So soft wave is ultrasound. So it's very different. So there's true lasers, and then there's fascinated lasers, and then things that will kind of umbrella under the laser. And
Mhm,
that's kind of what this is. It's not
mhm.
really a laser. But the ultrasound, what it does is it goes right down into the skin, right where the collagen and the elastin is being stimulated,
Mhm,
and it causes that deep thermal damage.
mhm.
Originally, there's all therapy. I feel like those are the two
Yeah,
that most people talk about, is
yeah.
all therapy and soft wave. So all therapy originally came out, it's a lot more painful, I think, than soft
Mhm,
wave. There's different levels, and so because of the fact that it's a little bit deeper, there's more issues or complications that you
mm,
can have with all
mhm.
therapy versus soft wave. And soft wave just found that sweet
Yeah,
spot of where the collagen elastin is stimulated. You can get through the treatment really quickly. And my favorite part is the fact that it really does give a true lift to the skin.
mhm,
So I really love doing around the eyebrow, like the eyebrow area.
mhm,
You can pop in a couple of pulses in that
mhm.
eyebrow area and instantly get a nice little lift.
Lift, yeah.
And then it just really helps with the jowls.
Mhm.
All of us start to get older and you're
Yep.
like, these jowls are driving me
Yeah,
crazy.
yeah,
Um, and this is actually able to kind of lift.
yeah.
Now, it's not plastic surgery,
Sure.
but it gives it a nice
Yeah,
little lift.
yeah.
And we do a ton on face and neck. We get the necklace lines.
Mhm,
Everybody has tech neck,
mm.
was another thing that
Yep.
is really popular. People talking about where you got your neck that you're bent down looking at your computer all
Mhm,
the time. And so now you have all these lines.
mhm.
So it just helps soften all of that.
Yeah. When anyone comes in, and I feel like a lot of people come in and do this, we're like,
Soft
"Okay,
wave.
Sofwave."
Yeah,
Yeah.
soft wave. Yep.
So if you do this,
Yeah,
this
exactly.
might be the treatment for
Yeah.
you.
And what's even more beautiful about it, there's no downtime.
There's really, I mean, we're hesitant to say no downtime, but truly,
No downtime.
there's There's no downtime.
I've had people come in during their lunch break
Mhm.
and do it. You might be slightly pink, but I feel
Yes.
like most of the time when I'm doing it on people, I'll be working one area and that
Mhm.
might be pink, and by
Yep.
the time I move to the other
It's
area,
gone.
the first area is already not pink
Yeah.
anymore.
Yeah.
And so it's really nice to be able to do that kind of treatment.
Mhm.
Like I said, it doesn't take very long.
Mhm.
You can do a treatment and depending on how small of an area, sometimes 30 minutes,
Mhm.
sometimes a bigger area, an hour and a half.
Yeah.
I mean, super quick and easy. No one's going to know that you did
Yeah.
anything, but they're going to make those comments like, you look well
Yep.
rested,
Yeah.
or what did you
Yeah.
do? Did you change your hair? And you just look
Yes.
healthier and
Yeah.
more lively.
The results are much more drastic than I would have expected
For
with
sure.
an ultrasound device.
Oh, for sure.
It's pretty amazing.
Yeah.
So
Yeah.
just like this.
Yes. So this is somebody, I mean, she's got nice, thick, beautiful skin,
Mhm.
but she just had in her neck area where she was having a little bit of laxity in
Mhm.
that area,
Mhm.
and getting that ultrasound in there to kind of just tighten and soften those lines, help tighten that up. And that's the nice thing I feel like when it comes to Sofwave, it's not just for like those older people too.
Mhm.
Like I have some of my clients that just anatomy wise, they
Mhm.
might not feel like they've got a nice lifted brow. And so
Mhm.
you can just work on those kind of areas to
Mhm.
help lift up the brow. As we get older too, our eyebrows on the corners start to kind of sink a little bit.
Mhm.
And being able to kind of put some energy in there to lift those up are really
Yeah.
nice. And it's a nice combination with Botox
Yeah. Yeah.
because Botox will help give that lift. And then we give it a little
Pull
extra.
those tails right up.
Tails right up. Yeah, exactly.
With her, you can really see if you look under her jaw,
For sure.
that skin is just very, so as we would say, snatched.
It's snatched.
Snatched
It
up.
got nice and tight.
Yeah, that looks great.
Hmm. So this is another one of those like necklace lines.
Mhm.
Um, and so a lot of times I talk to my clients about, as you can tell, I
Mhm.
talk to them about let's do injectables and
Mhm.
lasers and skin. So this is somebody where, she could do a little Botox in
Mhm.
her neck to kind of
Yep.
even make that look better.
Yeah.
And then also being able to do the soft wave to soften those lines and tighten that area.
Mhm.
And it just kind of makes you look younger because
Mhm.
a lot of times we focus just on our face
Yes. And
and
we
then
forget.
you're like, hey, my face looks
Yeah.
great, but why do I look so old on my
Uh-huh.
neck and my chest?
Uh-huh.
So
Yeah.
it's nice to be able to hit those other
Bring it
areas there.
down.
Yeah.
Yeah.
Bring it all down.
Bring it all down.
Yep.
Okay, so clarity toning.
Yep.
This is a fun one because this
Yeah.
is like a almost like a laser facial.
Hmm.
Talk about clarity.
Yeah. So this one is the people that I always say, I'm a little nervous to do lasers. I
Mhm.
want to try it, but I'm afraid it's going to hurt. This
Mhm.
is a great intro.
Mhm.
There isn't downtime with it. Basically, what we're doing is we're just toning the skin by lightly feathering some
Mhm.
heat over the skin.
Mhm.
Whenever you cause any kind of thermal damage, it stimulates collagen and elastin. The one thing I like about the clarity toning, though, is because you're adding that heat, it gives a nice clear glow to the skin
Mhm.
after the treatment
Mhm.
and it helps like shrink the pores up a
Mm.
little bit.
Mhm.
This one, because of the fact that we're not using so much energy in the skin, you really need to do it every couple of weeks.
Mhm.
And this is one that you're going to end up doing. I normally will say 4 to 6 treatments
Mhm.
of these.
Yeah.
It's a lower cost treatment,
Yeah.
so it's not super expensive. But most people will say, oh, it just felt nice, like I was hanging
Mhm.
out at the beach. It
Yeah.
was nice and warm
Yeah.
and it felt good. But it helps just give the skin a nice little glow.
Yeah. Okay, so
Stacking.
so again with synergy, everything works together.
Yes, it does.
So we have all these tools, but to really understand when someone comes in with specific concerns, how to utilize multiple
Hmm.
devices to get them, to their outcome.
Hmm.
Um, that's a big thing when it comes to laser stacking. So let's talk about that a little
Yeah.
bit.
So normally, like when I meet somebody and we're doing a Visio treatment and I'm looking at their skin, we're taking pictures, I will normally ask them, like, what really bothers you about
Mhm.
your skin?
Mhm.
And sometimes we're able to do one treatment, like
Mhm.
a one laser or one chemical peel or whatever it might be to kind of clear that one issue. But most of the time, people are like, I don't like this, and I don't like
Yeah.
this, and I don't like this.
Yeah.
And sometimes, whenever that's the case, being able to stack treatments,
Mhm.
because obviously our skin is in different layers. So we're trying to kind of hit those areas that are on the surface of the skin and also what is a little bit deeper in the skin.
Mhm.
So we have to use different modalities
Mhm.
to kind of get where we need to be.
Yeah.
So if somebody's like, oh, I've got the jowls or the laxity that's really bothering me, I'm going to automatically want to go to Sofwave,
Mhm.
right?
Mhm.
And then they're like, but I hate this sun damage
Mhm.
or I hate all these brown spots.
Mhm.
So I might do a MOXI BBL
Mhm.
and a
And the
soft
soft
wave,
wave. Yeah.
not all the same on the same day, but differently. And then
Mhm.
sometimes, like we were, talking about the BBL and Moxie, that's a great combination
Mhm.
of hitting that surface sun damage and then stimulating deeper damage below and
Mhm.
stimulating that collagen
Yeah.
elastin. There's lots of things that we can stack with
Yeah.
depending on what plane that we're trying to get
Right,
and hit.
exactly.
Yeah.
Some of the most popular are, as you mentioned, BBL
Hmm.
Moxie, BBL
That's
Halo.
another favorite.
It's a really good one.
Hmm.
Moxie and RF
Which
microneedling.
is great also too.
Yeah, and these can be done in the same
Yeah.
treatment. Sometimes we'll split them up,
Yeah.
but usually,
Most of the time, I always say, like, if you can do a nice little combination in one day, one, it's going to save you money
yeah.
doing it that way. And there's not as much of feeling like you're in all the time.
Mhm.
You can kind of knock out multiple things at one time.
Mhm.
And BBL and Halo is great for, like, we were talking about hitting surface, but sometimes you just have those stubborn little veins
Yeah.
or those stubborn little dark spots. That just won't go away. And being able to add that BBL to that halo
Mhm.
just really clears
Yeah.
everything up and makes a beautiful treatment.
Yeah.
And then Moxie and microneedling, another great one because
Mhm.
the RF microneedling is stimulating deeper into the skin,
Mhm.
and then the Moxie's really great for texture.
Yep.
So you're going to help stimulate deeper and help lift a little, and then you're going to help benefit the skin with the texture and
Yeah.
feel of the skin.
Just even everything
Yep,
right on
absolutely.
out.
Yep, for
There's
sure.
some stacked before and afters.
Yep.
So she did BBL and
Mm-hmm.
Moxie. Obviously, we can see why she did BBL for the sunspots.
Yeah.
She might still be in the healing phases in this after photo,
Hmm.
but overall, I mean, what a tremendous improvement.
Yeah, for sure. Yeah, she was definitely one of those that had some sun damage over the years, and just really wanted to get that treated.
Mhm.
But doing a combination of BBL and Moxie and making sure that we get not only the sun damage that's on the surface, but sun damage that's a little bit deeper into
Mhm.
the skin. And with sun damage, a lot of times the texture and feel of our skin's not
Mhm.
so great.
Right.
So being able to hit it with that Moxie at the same time just really gave
Yeah.
the skin a nice,
Yeah.
pretty
Great
look.
result.
Yeah,
Oh, fabulous.
yeah.
Another BBL Moxie.
Hmm. Same kind of concept. She had some sun damage. She also has some fine lines and wrinkles. And with that is going to be some texture issues.
Mhm.
So being able to clear it up with the BBL and the Moxie
Mhm.
just makes the skin look so pretty
Yeah.
afterwards.
Yeah, she
Yeah.
looks
I mean,
great.
she looks so much younger and brighter.
Mhm.
And really, the main purpose of this one is just clearing off the discoloration,
Yep.
right?
Yep. Oh, wow.
Yeah.
Fabulous.
So this one too, I feel like not only did it help with the color of it, but it softened those lines and wrinkles. So I feel like when we have some darkening in pigment, it kind of accentuates the fine lines and
Mhm.
wrinkles more.
Yes.
So just helping improve all of that just makes her look a lot brighter and fresher.
Yeah. BBL Halo.
Yeah.
Yes.
Yeah,
It's
this
a
is
good
a
one.
great one. So this is the reason why I say it's great to add a BBL to a halo,
Mhm.
because halo is going to be great for stimulating that collagen, help with the fine lines and wrinkles, help with just some of the texture and discoloration that's on the surface. But the BBL sometimes is able to hone into those little darker, deeper pigments that I say sometimes have little legs.
Yeah.
They go down deep into the
Yeah.
skin. And so you can hit it with the halo with that and then get some of that surface sun damage on the top with the
Yeah.
BBL.
Fabulous result.
Yeah.
Good.
So,
Uh,
yeah. So when it comes to this one, this is another one where somebody that is got some redness. Now, halo is will help a little bit when it comes to the underlying redness, but if I've got somebody that I can look at their skin and see they've got some broken capillaries, they've got some flushing that is happening with their skin, I always want to do a BBL with the halo,
mhm,
because the BBL is going to help shrink those little capillaries and
mhm.
really help keep it under control. So it's amazing for
Yeah.
underlying redness,
Yeah. Okay, so we really pride ourselves in our consultation
for
process.
sure.
And when someone comes in and starts their journey, what is the first thing that you do with them?
So my first thing is I always want to do a Visia
Mhm,
on them. I want to, and our Visia is basically taking pictures of the skin, but it's also showing what's going on in the surface and what's going on a little bit deeper.
mhm,
And then really finding out what bothers them. I can look at somebody's skin and I see certain things,
mhm.
but that might not be what bothers you,
Right.
right?
Right.
So I want to hear from them. What is the first thing that really bothers me? And
Yeah.
I want to make sure that I hit that first.
Yeah.
And I really like to get a nice little treatment plan.
Mhm.
So let's start here, and
Yep.
then we'll go here,
Mhm.
and then we'll reevaluate, and then have them come back in for maybe another Visia
Yeah.
to see the improvement. And it's always nice not only to see pictures, but also to see like cold hard facts. Like
Mhm.
this is the improvement, this is the percentage and improvement with your skin. And I just think it's really important
Yeah.
to be able to have that like circle around
Absolutely. So if you don't know where to start, come in for a consultation,
for sure.
and we will guide you through this journey. We know it can be overwhelming,
That's a
so
lot.
just come on in. We'll hold your
Perfect.
hand.
Absolutely.
We kind of went over what to expect with lasers, but I mean, typically with any of the lasers, you're looking at 3 to 5 days of downtime.
Mhm.
A lot of downtime these days is very simple. You can put something
For
on.
sure.
We'll make sure that you have all the post care products that you need.
Mhm.
Like you said, we'll take Visia photos and just
Yeah.
really keep an eye on everything. So that's
Yep.
kind of what to expect as a whole when you come in for any skin service, any aesthetic service.
Yep.
If you are not a member of our Fab Beauty Vault, we would love for you to
Yeah.
be a member. If you are thinking about coming in for treatments and want to make it a more regular thing, you can join our Beauty Vault
Mhm.
and you will have access. You basically put money into your vault every month.
Mhm.
That goes towards any treatment that you want to do, but it unlocks access to 15% off med spa services, 10% off products,
Mhm.
20% off laser and skin packages, and 50% off for like all of our add-ons.
I always tell my clients, like, if you're doing injectables, you're doing lasers, this is kind of like a no-brainer
Yes.
because you're not paying for the
Right.
membership.
Right.
You're just putting money into account for it's
Mhm.
like a savings account, a
Yep.
beauty savings account. So
Exactly.
you're putting that money in that account to just have access to all these
Yeah.
discounts.
Yeah.
So why not do it?
Yeah. Why not?
Yep.
Join our beauty vault.
Yes.
Okay, so I see there's a few questions. We are almost at time, so let's just go through these rapid fire.
Okay.
I am going to start with, um, let's see. Oh, this is a good one. And I think we can kind of make this a more general question.
Mhm.
With BBL or with any of the laser treatments, you mentioned spacing them out.
Mhm.
Typically, how far are you spacing out these treatments if you do want to do like a regular,
Yeah, it's usually 4 weeks.
4 weeks?
Yeah.
Yeah. Let's see. What is the best treatment to help with the under eye skin?
So most of the time when it comes to lasers, as long as I'm staying outside the orbital
Hmm.
rim, so like around your eye, if I can get on the bone, I usually tell my clients I am going to pull that skin down as far as I possibly
Yeah.
can to get as much skin
Yeah.
as I can. And the way we angle the laser,
Hmm.
so that everything is safe, I'm going to get as close as possible.
Hmm.
Sofwave is another one too. Like you can get like right up on this bone
Hmm.
too, which is really nice.
If you want more of a lift.
More of a
Yeah.
lift.
Yeah.
Mm-hmm.
Yeah.
Yeah.
Oh, I like this one. What would you recommend for sun damaged arms?
Yeah.
And also with KP?
Yeah. So sun damage arms, BBL all day
Yeah,
long. The
yeah.
nice thing about BBL is you can actually do BBL from like your forehead down to your toes. Like you can do full body, which is amazing.
Mhm.
Because most of us have sun damage and yeah,
Everywhere.
everywhere.
Mhm.
Yeah. So you can kind of hit all of that. KP is one of those that I feel like is a little bit harder.
Mhm.
We do like some chemical peels on the body when it comes to KP.
Mhm.
I've heard some lasers, but I've not really heard a whole lot that I've seen huge results when
Mhm.
it comes to KP. I
Yeah.
think we have even talked a little
Oh,
bit
yeah.
about it.
Mhm.
Just trying to figure out what we can come up with.
Mhm.
Um,
I did a BBL MOXI on my arms,
yeah.
and it basically took away all of the bumpiness,
Mm-hmm.
and the redness,
Mm-hmm.
and I kinda stand by that now.
Yeah.
I love it.
Yeah. So I mean, we will do BBL I've done even the Moxie's
Mm.
face, neck, chest, arms, legs. I've
Mhm.
done it kind of everywhere.
Yeah.
Yeah.
There's a few questions about the before and after pictures.
Mm-hmm.
Most of these pictures were taken after 2 to 3
Yeah.
treatments. I don't know that any of them was just one treatment. So, like we were saying, depending on the damage that you have, it took a long time for you to get it, and sometimes it takes a little bit of work to get it
Mm-hmm.
away, which is again why we really lean on our packages.
Yeah.
So, just have that in your mind when you're
Yeah.
starting your laser journey.
For sure. Yeah.
Oh, what is the best treatment a week before an event?
Mm. So I normally will not do any kind of laser treatment with a week before an event. I usually say 2 weeks.
Yeah, yeah.
Because especially veins can be a
Oh,
little
yeah.
tricky.
Mhm.
So sometimes you might get that one vein that might turn a little purple and it takes 2 weeks for it to go away. So I'd rather be safe than sorry.
Mhm.
So most of the time I tell people if you've got a wedding coming up, let's hit it at least 2 weeks prior. So you've got plenty of time for healing. Normally for most people it's 7 to 10 days, but I just like that little extra buffer.
Mhm.
So if it's a week before a wedding, most of the time I'm going to say Diamond Glow.
Yeah, yeah, that's a safe one.
Yeah,
Yeah,
that's a great one
yeah,
or even glass skin.
yeah. So plan for 2 weeks before your event.
Yes, for sure.
And come in before and just kinda make sure you know how your skin responds, and I think
Yeah.
that's always important.
Yeah, because you just don't know. You might feel like you're not sensitive to
Mhm.
things and your skin has never had a reaction to anything, and it'll be the one time that
Mhm.
something wild will happen.
Yeah.
So I normally don't like to treat somebody for the very first time
Mhm.
right before an event like that. I want a couple of weeks.
We got some really amazing questions. We'll make sure to answer these after the webinar.
Hmm.
We'll do one last one. I like this question. Can you get, I think they're asking if you can do Botox and filler on the same day as a laser treatment.
Can you do Botox and filler and laser all the same
Hmm.
day?
Hmm.
Not normally. It depends on what it is, though.
Hmm.
So if you were doing a soft wave,
Sofwave, yeah.
yeah. So if you're doing soft wave, you can absolutely
Hmm.
do injectables after that. That's not going to create any kind of issue.
Hmm.
But anytime you are doing a laser, if you're breaking the skin or causing any issues on
Hmm.
the skin,
Hmm.
they don't want to be injecting into that skin
Right.
either. It's just not worth it.
Yeah.
And so I normally will say, no, let's keep it a couple of weeks apart. And
Hmm.
then if you're doing filler, I usually will say give it at least 4 weeks before I do
Hmm.
any laser because you don't want to manipulate it.
Right. Yeah.
So
Yeah.
you just want to I'd rather be safe than sorry.
Always rather be safe than sorry.
Yep.
And on that note, we would just like to thank you all for joining us today. We hope that we answered and demystified some of your questions about laser.
Yep.
There are a lot of lasers out there, but I think the takeaway is trust your provider.
For sure.
Go to someone that has experience and that can really speak to things on like a skin level,
Hmm.
because like you said, you can have the device,
You can push buttons.
you can push buttons,
Yep.
but if you don't understand
Mhm.
skin and layers of skin and anatomy,
It could
you
be
it
disastrous.
could be it could be it can be. We've seen on social media
Yeah.
what can happen.
Yeah.
So again, thank you all. Please take advantage of the specials, and we cannot wait to see you
Yep.
this laser season.
Thank you so much.
Thank you.
Bye.
Bye.